Hey everyone, this is what turns out to be the last chronologically, but the first in terms of the bones that we studied, of some quick tutorials about the groups of bones that you're going to need to know for the second lab practical. So, we're going to look at the pelvic girdle, which consists of just one bone for our purposes, the coxa. The other bone would be the sacrum, which we studied in the last chunk of bones, and the pectoral girdle, which contains the scapula, the sternum, the clavicle, and all 24 of the ribs. So, let's first talk about the scapula. So the scapula is the front surface of the scapula, so this part lies against the ribs. This is the posterior surface of the scapula. We have a number of borders that help us to kind of figure out where various structures are. The medial border is this surface here, the superior border is on top, the inferior angle is underneath here, and the lateral border is this sort of curved border right here. And that primarily are just landmarks to kind of help us figure out what side of the bone we're looking at. And that in turn can help us figure out what side of the body each of these bones is on. So if we look at this is the posterior surface again. From the back, we can see the spine, this ridge right here. We sort of know this as the shoulder blade. So when we feel this spot on our upper back, this would be the spine of the scapula. And we notice that the spine, toward its end, as we go out toward the lateral side, toward the outside of the bone, we notice that it flattens out and gets a lot wider. This wider part out here is called the acromion, often referred to as the acromion process. So, it's going to be important to remember that the acromion is the part at the end of the spine that widens out here. Above the spine, we have the supraspinous fossa and the infraspinous fossa below. Supra and infra are prefixes that are similar to superior and inferior. So that should be something that jogs your memory in terms of word association. So if we look at this bone from the side, we notice that we have the glenoid cavity. Now this is the socket in the ball and socket joint that is the shoulder. The head of the humerus is the ball in this scenario. So the fact that this is very shallow means that the shoulder has a very wide range of motion. And then if we look at it from the side, this is the acromion that sticks quite a bit further out. You can see the spine sort of behind it here. And this curved process, which sticks out toward the front of the bone, is called the coracoid process. So it's smaller, and it's a lot closer into the rest of the bone. So that's a good way to differentiate the two. This, incidentally, is a left scapula. The reason I know that is that the glenoid cavity, this part sticks out toward my left side. I know it's a little difficult to see from the video, but out toward my left. And we can put it on our back just like this. I realize that everything is flipped for me. It may not be for you, but this is definitely a left scapula. And if you're still stuck on that, I'm happy to show you. So on the outside of the scapula, we know we have the acromion, or the acromion process, and there's something on the clavicle that looks very similar to that called the acromial end. And as it turns out, the clavicle actually connects at its acromial end. I realize that I'm completely in the way here, but that is approximately the way that the acromial end of the clavicle attaches to the acromion of the scapula. So we're still looking at the outside of the shoulder joint here. This right here is the acromial end of the clavicle, which connects obviously with the scapula, and over here we have this sort of shorter, thicker end, which is called the sternal end. This connects with the manubrium of the sternum, that top part at the top of the sternum. So anytime you see this S-shaped bone, you're looking at the clavicle, and really all you need to know are the acromial end and the sternal end over here. So, speaking of the sternum, we may as well go on to that. We have three parts to the sternum. It's very, very simple. This is right side up. We know that the thickest part of the sternum is at the top. This part is called the manubrium. Then we have a thinner, longer part in the middle, which is called the body, and then this part that sticks out toward the bottom is called the xiphoid process. That's the part that I asked you to find on your rats when you dissected them earlier in the year. We know, of course, that those queer plastic parts on the sternum that are attached here are bands of cartilage called costal cartilage, and costal is a word that refers to the ribs. So this is a rib. We have 24 of them, 12 pairs, so 12 on either side. The first 7 pairs are what we call true ribs. They attach directly to the sternum via that costal cartilage. Ribs 8 through 10 are, or pairs 8 through 10, I should say, are called false ribs because they indirectly connect to the sternum through cartilage. And the last 2 pairs are called floating ribs because they don't connect in the front at all. So this part right here, this flat end, which you can see as I bring it toward the camera, that is the sternal end of the rib. The cartilage has a flat edge, and this end, as you can see, does as well. Now, the slightly curved end back here, the part with some sort of interesting features, is the part that connects with the thoracic vertebrae. So we have the head and the neck, and then this entire intermediate part in between the head and the sternal end of the rib is called the shaft. So that's your ribs. We have true, false, and floating ribs. We have 24 of them in all, and these are the parts you need to know. Okay, so on to maybe the most difficult bone of the ones that I'm asking you to study in the pelvic and pectoral girdles, the coxa. So the coxa is the clinical name for the hip bone. I will expect you to refer to this as the coxa because we are trying to use the language of anatomy. And if we look at it from about this angle here, we can see most of the major features here. So this top part at the top is called, the ilium. This part flares out toward the side, and this is the back of the ilium, and here is the front. Then we have the acetabulum here. The acetabulum of the coxa connects with the head of the femur to form the hip joint. So when we're talking about the parts that form the hip joint, that's what we're talking about. Then we have this part, which is sort of has a flat edge here. This actually connects with the other coxa on the other side. This part is called the pubis. And then the rounded part toward the back of the bone is known as the ischium. For some reason, a lot of people confuse these two, so make sure you have these two straight, because that will give you a much better chance of getting the rest of the things right. So, if we look a little closer here, if we look more closely at the ilium, we notice that we have the iliac crest is the ridge that runs all the way from one end to the other. And on either end, they're sort of bounded by spines. So, the anterior, superior iliac spine is right here. Anterior meaning toward the front, superior meaning up above other structures. Then we have the posterior superior iliac spine, and that, again, is named for the fact that it's toward the back of the body. As we go a little further down, we can see on the posterior side we have the greater sciatic notch, which is this curve here. Below this spike here, we have the lesser sciatic notch. The parts of the sciatic nerve go through both of those. And in between, as sort of a dividing point between them, we have the ischial spine, which is this spike right here. So again, the greater sciatic notch is here, the ischial spine is in the middle, and then the lesser sciatic notch is below. Now, if we just turn this ever so slightly, there are 2 more things to know, 3 more really. We have the ischial tuberosity, which is this rounded part right here. That's the part that you actually sit on. So if you're sitting in a chair watching this video right now, this is what you're sitting on. And then we have the pubic crest at the front. That's the sort of surface of the pubis right here. And then the obturator foramen is this opening right there. So I believe that is all you need to know about the pelvic and pectoral girdles. We'll obviously go through some details in class next week, but hopefully this helps you to bring it all together. Thanks a lot.